and welcome to The Black Unconscious,
a mental health podcast about living, coping, and thriving while Black.
I'm Raquel Martin, a PhD candidate in medical and clinical psychology.
And I'm Dr. Justin Hopkins, a licensed clinical psychologist.
This podcast is not meant to be a substitute for a therapeutic relationship with a licensed therapist.
Thank you for tuning in, and we hope you enjoy the show.
Hello, and welcome to The Black Unconscious. We are your hosts. I am Raquel Martin.
And I am Dr. Justin Hopkins.
And today we are doing an extension of our last depression episode. The last episode was Oppression and Depression 101. And this one is going to be Oppression and Depression 201. We are on episode 27, guys. Season 2.
That's right.
Progress is being made.
Yeah, I can't believe we're already up to 27. The first time we talked about this topic, it was actually our 4th episode ever back in season 1. And we covered a lot of different things, but we were hoping to kind of extend that conversation. We'll probably end up touching on a few things that may be similar, but we want to include other things because this is a really complicated topic. I think it touches everyone, and in particular those with marginalized identities. So why don't we get right into it? What do we want to talk about today, Raquel?
So I definitely want to start off with the different types of depression. I wanted to do a big focus on depression in men, actually, with this episode.
Mm-hmm.
I want to talk a lot about that. Because I do think we talk about depression a lot when it comes to society. I think it's been really well put in media lately. But I don't think a lot of people know that depression can manifest very differently in men. I think being able to have you as a co-host would be really helpful to talk more about what you've seen or even what you think different people may experience when it comes to depression with the male, because there's one thing with just the mental health part of it and the diagnostic part of it, but it's another thing with the fact that you are a Black man, and you can probably think in some ways of how some people would just blow off symptoms that are pretty prevalent.
Yeah, absolutely. It's harder. It can be harder in men to figure out their symptoms, because there are a lot of roadblocks that we have internally to actually identify and acknowledge those things. So we can definitely get into that. I also want to talk about in general, and again, we touched on this, but there's so much more, just how oppression leads to depression. And then lastly, of course, what are some things that we can do to work with those feelings, cope with those feelings, and get ourselves to a place where we're just feeling better overall. One
of the things we wanted to start with today is talking to everyone about the different types of depression. There's more than one kind of depression. I think the main one people think of is major depressive disorder, right? That's the first one people think of. We got that one down.
Yeah, so there's major depressive disorder, and that's and you can have what's called a single episode, where you're feeling depressed only for that one particular time period. I won't go too far into the details of the diagnosis, but it's usually symptoms can include issues with eating, your appetite change, either overeating or not eating as much, loss of appetite, disinterest in things that usually bring you pleasure, feelings of hopelessness, of course, your mood being down, just feeling lethargic, lack of energy. And I think I'd already mentioned just feeling like there's no hope in the world, right? In the future, you imagine that you'll always kind of feel down and depressed. It can also come with feelings of guilt and shame. And so with a single episode, that happens just at one time. But of course, there are other scenarios where people can have multiple episodes. And typically, when you're having a major depressive episode, it does take about 6 months to a year, usually, for people to work through that. It takes time. Depression is not a small, simple, or quick kind of disorder. It actually really takes time to recover. And even certain antidepressant medications can take up to 2 to 3 months to actually start kicking in. And of course, therapy is one of those things that takes consistency, time, and effort as well. So just in general, it's a big deal, and it's not one of those easy, quick fixes. Something that you can just kind of snap out of. Of course, it is actual. It's a really hard condition to work with, but one that people can gain a lot of progress on with the right course of treatment.
Yes, and I will say one thing that I always tell parents that I work with, who have concerns about their child's mood and irritability and stuff like that in children. Like, so the same way that depressed mood most of the day, almost every day, is like one of the prime symptoms of depression for adults and for children as well. But for children and adolescents, that can be subbed in for irritable mood.
Yes.
Right?
Yes.
So irritable mood most of the
Yeah.
day, nearly every day, can be an indicator of depressive symptoms for your child. And if you're combining like this irritable mood, like this presentation for at least like 2 weeks of irritability, fatigue or loss of energy every day, diminished ability to concentrate, insomnia or hypersomnia, I mean, that comes up a lot with teens. Okay, so like,
Yeah.
don't solely think that like, oh, he doesn't seem too down, he just seems like a jerk.
Right.
Well, like,
Right.
like the irritable mood is most of the time how it manifests in teenagers, right? So just think of it that way.
Absolutely. It's also it also happens with adults as well. And right, and I think it's just important to remember, right? Depression is not something that's always visible. In fact, often it's not, because we can do different things with our emotions to conceal them. In fact, most people are actually really good at doing that. And so, although someone may not appear like they are down and sad, doesn't mean that they aren't. And so that's a really good point, Raquel. Like the irritability in particular is a really it's a really telling sign, especially in adolescents, but also absolutely in adults. And what we'll talk about more is in men, how their feelings get externalized and they're more visible in their behaviors rather than in their general mood.
Yeah,
I think another thing, just to add on to that, is also you can feel isolated, or you can start to isolate or withdraw socially. As you mentioned, the issues with sleep, it's a physical condition as well, just as much as it is emotional.
Yeah, and I would definitely say the physical symptoms are the ones that I definitely pay attention to the most, because like in my research of minority health disparities, minorities are more likely to when they're talking to like mental health clinicians and professionals, they're more likely to state the physiological symptoms, right? Like when it comes to anxiety is really stuck into the gut, right? Like anxiety is connected to the gut, stomach issues, IBS, so like not being able to process food well, digestion issues and stuff like that. With depression, the somatic symptom, one of the big things I look at is sleep. Sleep is one of the diagnostic criteria for like most mental health disorders, right? Like if you look in the DSM, like sleep, fatigue, that's always in it, right? That's a big somatic symptom. I always look at the sleep of my patients, like, so what's going on, like you tripping, because that also sticks to irritability too, right? How many of us are in a good mood when we're not sleeping, man? I'm not.
A lot of those things go hand in hand for sure. I think another type of depression is called dysthymia, or what's been renamed in the ICD. It's another ICD-10 is what we're on. It's another text that we used.
What's the ICD-10?
The ICD-10, it's basically our diagnostic code system. It is called...
no, you don't have to just say it's a diagnostic code system.
Okay.
You're saying ICD-10 like, oh yeah, like earth, wind, water, ICD-10. Don't nobody know what that is? That's not mental health.
Well, I mean, I was going to explain.
That wasn't a big word thing. That was just ICD-10 thing. Like that actually... That's okay.
So we know the DSM, right? It's the Diagnostic Statistical Manual, but then the ICD-10 is the International Classification of Diseases, and so that the ICD is more consistent across countries, and so we've recently gone over into using the ICD-10 more and more in our medical system here in America, but and the ICD-10 is called persistent depressive disorder. And then in the DSM is called dysthymia. It's the same condition. It's basically like a lower level of depression that lasts for about 2 years, essentially. And so you can see some of the same symptoms in a major depressive episode, but they may not be as severe and there might not be as many. And this is a little bit longer lasting.
A lot longer. Like
Yeah, right. and also you can have major depressive episodes while having that lower underlying level of depression for 2 years or more. And so you can have some comorbid diagnoses, or rather conditions.
Yeah, the biggest difference with dysthymia is the length of time. Right?
Yes.
Like
Yes.
you have to, in order to meet the criteria for dysthymia, for persistent depressive disorder, you have to have these symptoms present for at least continuously for 2 years.
Yeah. Yes,
That's a
that is
long time.
correct.
And it sounds like a long time for us, but think about how much worse it is for the people who are actually going through it, cuz there are plenty of people
Yeah.
who meet this criteria, right? Like a lot of times we try to work with individuals with their thought processes and the way they process things and the reaction in different situations, but we can't change people's situations, right? And sometimes the
Yeah.
things that are contributing to them being in depression are their environment.
Yeah.
So it's
Right.
very hard for them to get out of that thought process, especially if they're not seeing a clinician. So
Yeah.
I think it's very understandable to understand I am such a poet. Why people why people can be in this state for such a long period of time.
Yeah, yeah, absolutely. The hope is that, at some point you can kind of work towards like changing how you experience those external factors that may not be changing, or how you perceive them. But it is challenging for folks. Possible, but also challenging. Another type of depression, postpartum depression.
Yeah, and I think postpartum depression is getting like a lot of education and like knowledge in the environment lately. Like I think a lot of people are bringing light to it so that people can look out for it when it comes down
Yes.
to it.
Yeah,
Because there's so much that
absolutely.
goes
It's
into having a child when it comes to the fact like you make this whole person, things may not happen exactly how you wanted it to. There's the healing process, there all these factors that can contribute to you being depressed, to giving all your
yeah.
energy and time to this one little being, to being exhausted, to losing yourself in it. It's just a lot.
Mm-hmm.
Which is why it develops, and it's more than just I think they used to call it the baby blues, but
Mm-hmm.
it's like
Mm-hmm.
it's a pretty serious thing. And I actually like
Mm-hmm.
how much I hear about it now. I feel like, do you feel like it's in the media more?
I do. I feel like people are talking about it more. I think for a while, a lot of mothers would be suffering in silence, and it wouldn't get enough attention, and even there would be some really stigmatizing ideas about women who deal with depression after giving birth. But I feel like we're coming back on that. Stigma in general is, I think, decreasing. But I think more and more people are talking about postpartum because it's really not uncommon. And there's also an even lower grade of postpartum called postpartum blues. Oh, instead of like the postpartum depression, it's just called postpartum blues.
Oh, I think that's the
And
baby blues thing that I was thinking of.
you might be right. People refer to it differently, but it's a common phenomenon for women. I think upwards of 50 to 80% of women actually experience that lower grade of feeling down after they've given birth. And if you think about it, right, this is a major life event. Like there's a person, right, giving birth. Like obviously you could just created a human, right? But there's something inside of you, a human inside of you that has come out, and there's a different attachment, right? There's a difference in connection between like the baby once it's born versus when it was inside the mother's womb. And also, don't forget all of the chemical changes that a woman goes through physically during that time that also contribute to those conditions. So it's just another type of depression that I think is important for us to note.
You know what else I was thinking about? Like, we always think about the attachment when a child comes out, but there can also be situations where a mother doesn't really feel that much attachment in the beginning.
That's
Um,
possible too.
or they just feel like it's too hard, or it's more than you expect,
Yeah.
or like any
Yes.
reaction that you
Yes.
have to having a child
Mm.
is normal because it's going to be your reaction, so it's already okay, and it's already like things
Mm.
that you should be
Mm.
tuning into. So you may feel different if you don't feel too attached. And it's also the fact that like you have this person, they give them to you. You don't know this, like they don't know you. This baby doesn't know you can take care of them. They're like, so you just gonna send me home with her like day one for real? Like you think this is safe, dude? Like, and you don't even know what to do.
Yeah.
It's just like, and everyone's like, oh,
Yeah.
it'll just kick in. Why? Why did it just kick in? It didn't.
Right.
Why do you think that? Like, I think the
Right.
stressors with that is just like, I don't even know this child. I mean, I knew the one who was inside of me. I don't really know this dude. He looks different. Are we sure this is mine? Are we
Yeah,
kidding?
this. I mean, it's so right. You have to like meet your child, right? Like
you have to meet your child,
right? And your child has to meet you. You know, it's like so. There's a lot that can happen in that, and your child's temperament might be different from yours. You know, and maybe there's you know, and even with like latching, right? Like breastfeeding, like how the baby latches. Like there's so much to feel insecure about, or to worry about, feel anxious about. To doubt yourself over as a new mom. And that all contributes to the depression that can happen after giving birth.
Yeah, you're right. That's the perfect storm for why the symptoms happen and like when they come up.
Mm-hmm. Absolutely.
Right, next one.
Seasonal affective disorder.
Yeah, I was about to say I love so seasonal affective disorder, which is depression with the seasons. It's called SAD. I call it SAD. Is that not
it is.
the most
that is
ironic?
that is the that is the acronym for it.
That's the acronym, and it's SAD.
Yeah,
because it's
yeah.
It cracks.
And basically,
me up. Funny
like,
is funny to me. Jeez.
No, go ahead.
Justin,
sorry.
You're not gonna laugh at it. Seasonal affective disorder, SAD. Does that not make you laugh every time you read it, dude?
I mean, it's a little cliche, right?
Yeah, I like cliche, corny jokes. I have the most basic sense of humor in life, like typical fart jokes and curse words. That's my humor. Okay, all right.
Yeah.
You're the adult here today, clearly. Okay, you go.
Raquel, your humor, like, it's
the
I'm
most basic humor in life.
I just get like stuck in the laugh sometimes. I don't know.
All right. Okay.
But SAD, yeah, seasonal affective disorder. So right, it's essentially like in a nutshell, it's a change of mood that comes on with the season, and you can see some of the same symptoms that you would see in like major depression or dysthymia, including not only the depressed mood but loss of interest and pleasure, changes in appetite and sleep, all of those same things that we just discussed. And so treatment for this, I mean, there's a lot of theories for like how this happens and how it develops. Talk therapy is very helpful for it. Also, antidepressants, of course, but for some people, it is about the light and the lack of light that they're receiving, and so light therapy is actually a thing for it. Actually, like taking in the light and making sure you're getting as much vitamin D as possible. Like all those things can be a part of treatment for SAD, and just trying to manage those like cyclical seasonal conditions.
Yeah, and it's understandable because if you're in the area where you're used to seeing the sun every single day, you're used to being able to go outside, and if going outside is one of your biggest things that helps you become active and helps you, maintain that like certain level of dopamine and stuff, and then it just stops. Like your body's not accustomed to that. It's also just the fact that you're used to seeing skin everywhere, and everybody's wearing like sweaters and vests and parkas. It's depressing.
Yeah. Coats.
Nobody's walking in. Nobody is like, I don't want to see you in that coat. What are you doing? Like, just show a little skin. Everybody likes a nice, sundress and basketball shorts.
Well, with the change of seasons does come like a change of activities that you engage in, right? And that can be hard for people too, because behaviorally you're not engaging in the same things that would keep you upbeat and excited about your day-to-day activities, And it can also be isolating, right? So it's not just about the level of light that you're receiving all the time. Sometimes it is a matter of how the environment changes and the things that you're able to enjoy and that actually do, consciously or unconsciously, keep you afloat and getting the kind of enjoyment out of life that you want. That can be altered during the seasons, and and that's a part of it as well.
Yeah, because some people just don't socialize as much when it's cold outside anyway, or when it's stormy outside. Like a lot of people want to stay inside and separate and things like that. And if you are a more social person, you do feel really isolated by that.
Yes.
So that can be concerning.
Yeah. Yeah. So we just got 2 more left, and we can go through these really, really quickly. Raquel, you want to take the lead?
Never.
Okay.
So there's manic depressive disorder, which is the depression disorder that is attributed to bipolar disorder.
Yeah.
So if anyone has ever heard about bipolar disorder, or anyone who suffered from them, the way I think about it is just the difference in poles. So like North Pole, South Pole, right? Like the opposite ends of the Earth. Hopefully that's right, geography wise.
I'm sure
I didn't major in maps, but think about that in terms of the differences within personalities. That's the easiest way for me to remember it when it came to studying for things. So like depressive disorder, what do you think about with depression? It's basically every single thing we talked about.
Mm-hmm.
It's like typical fatigue, feeling down, depressed mood most of the day, nearly every single day. But it's way more severe than major depressive disorder. It's even more difficult to deal with because you have both poles that you're dealing with individuals who have bipolar disorder, and the other one is the manic episodes that individuals are talking about. And it's so difficult to... I think the ways I've seen it described are the ways that I've seen it when it's manifested in patients. It's like you're seeing two totally different people. And it's very easy to see when someone's in a depressive episode because they're down, they don't really want to deal with anyone and stuff like that. But then when they're in the manic episode, there's so many things going on. It's exhausting. I think what is her name, the Jennifer Lewis, she said she always described it, she said mania is exhausting.
And for those who don't know her, Jennifer Lewis currently, I mean, she's a renowned actor, but currently one of her biggest roles is the paternal grandmother on Blackish.
Yeah, she's amazing. And if you don't know her, how dare you? Okay.
But it is
the mother of Black Hollywood. I wish I could do her voice, but I cannot.
But she's also she's very outspoken about that and how it affects her. But the mania is also marked by like really, really elevated mood. I mean, like expansive, and at times you can even feel really strange or bizarre, like impulsive and making really fast and rash decisions.
Thoughts of grandeur are the biggest. That's when someone is in a manic episode. Those are the biggest thing I can see. Like I can do this. I can do all of this. All this is just like I can answer this question. I can do all this. Like the thoughts of grandeur, mind blowing. And exhausting, and they're incredibly exhausting for the individuals who are taking care of them, who are trying to deal with them and trying to like help them realize they're in a manic episode. Because manic episodes can be exhausting, but for some people it's when they get a lot of stuff done, right? Like you're not really sleeping like that. You have so many ideas in your head. You have so much time to spend and do on all these ideas and make sure stuff is getting done. Like you can see how there's a utility to mania at times, but then you hit that other end. You hit that other pole of the disorder.
I would say maybe if someone is what's called like hypomanic, like because hypomanic is like it's like a smaller version of mania where
and that's when you can actually do something.
Yeah, like maybe you might get some things done, but I definitely wouldn't say like it's productive. Like neither hypomania or mania, because you kind of like lose touch with what's real, because there's so much energy and you're so expansive, and like you said, there's so many thoughts of like grandeur. It's like you feel like you can do anything, you don't need sleep. So that's that being in that space, like mania is like you cannot miss it. Like you will know, because it does look like a psychotic episode.
But it's also in the eye of the beholder too, right? Like we can see it on the outside in, right? Like saying like this cannot be productive, this cannot be useful. But for the individual going through it, like going through it during that one episode, who's avoiding their meds, who's doing all this, and the reason that they're stating why, they may find some utility in it. They may decide that they don't want to change their personality. They may decide that these little spouts of being in mania aren't enough to be on medication. Like we see it on the outside looking in, but people who are in it, the way they describe it, like they have to be exhausted in order to decide to stop. Because Jennifer Lewis said it took her psychiatrist like 7 years or something to convince her to be on medication.
I think it was like 5 or something years. Yeah, something like that. Yeah. Because she thought that taking away her mania would also take away her edge or her personality and kind of dim her light, especially as a star. So yeah, you might be right about that. I think that's true, actually. I also think that it's, well, you mentioned earlier, like it's kind of like hard to treat because the medications for it takes a lot of time to kind of find the right dose that works, particularly for bipolar.
It's like a cocktail. Like it'd be great if it came out right the first time, but I mean,
hmm
sometimes it doesn't, and you have to be willing to work with the person in that. You have to be
yeah,
willing to say like, okay, I tried this for a couple of months, I don't like this symptom or this symptom, can we
yeah,
adjust it, instead of just being like, I'm done, I'm not going to take this
right,
medication anymore.
right. It takes time to get it right. It does. It really does. But with each of these things, like it takes lifestyle management to kind of rein uh, to rein in some of these longer term treatments and longer term conditions rather, and to really keep yourself in a place where you can function at the way that you'd like to. But that's especially true for bipolar, I think. And then the last one that we just want to touch on briefly is just situational depression, or what's formerly known as adjustment disorder, right? Where it's basically like something in your life does happen that's objectively just really challenging and or subjectively really challenging, right? Because it is in the eye of the beholder and the person who's experiencing it, as Raquel just said. And so when that it's actually a common one that you see on like college campuses and in universities, because it can be hard adjusting to a new campus, a new setting, and yeah, I think people often do struggle with that when there's just like big life changes essentially.
Yeah, and it could be, I mean, like, it can be I think a lot of things meet the requirements for adjustment disorder. Loss of a relationship, it takes a while to adjust. Loss of a
Sure.
loved one, well, that can be a grief or bereavement disorder.
Yeah.
Moving to a different location. A lot of times I see this with patients when they have to switch schools that they did not want to switch, and that's really, really hard for kids in the first
Yeah.
place, or even anyone. Like, I'm switching. I think if I had to go from like one university to another, that could be really difficult. We've talked before about being at HBCU and going to a PWI was a completely different experience for us. Adjusting that, so it's basically it's like life, the way your emotions and your body and stuff react to a new experience.
Yeah.
Negatively.
Yeah. Yeah. Absolutely. Absolutely. Yeah, so I think we covered most of the different types of depression, or how depression might show up in people's lives.
Oh, I did want to add
And
one more thing with the adjustment disorder, though.
oh, sure.
So like the way that we're looking into it more is like adjustment disorder, with more of a depressed mood, because adjustment disorder is actually, it can more so be under the criteria of like stressor related disorders, and it really means that like you're having these identifiable symptoms occurring like 3 months after the onset of the stressor, right? But it can also it doesn't have to be with depression, right? Like you can have adjustment disorder
hmm
with depressed mood. You can have it with anxiety. You can have it with
Yes.
anxiety and
Yes, it's
depressed
true.
mood.
Yeah.
You can have it with disturbance of conduct, which is what I see a lot of times when they switch schools and they just start
Mm.
tripping. Um,
Yeah. Yeah.
but it's really like the biggest thing is that the distress is out of proportion with like the severity or the intensity of the stressor, like taking into account everything. You just think that like this is greater than what you would expect in terms of adjustment. But don't think you just have to have depressed symptoms as a result of adjustment disorder. You can also have anxiety, combination
hmm
of the two, or anything. It's really just it's a response to like a recent onset of stressors.
No, I'm glad you're making that point, because it's often sometimes, I mean, there's a larger discussion to be had about like really like how encompassing are these categories, right? Because the way that I understand diagnoses in general is just like it's our best shot at like categorizing like the very large scope and spectrum of like human behavior and experience. And so inevitably like some of those categories are going to be insufficient. And so, for example, depression and anxiety almost always go hand in hand on some level. And so adjustment disorder is actually is one of the few like categories that I think really makes ample space for that, where you can where there are like these where you can specify that it's both are very, very present, and that's I just think that's important to note, right? Like all of these things, like they're just our best shot at categorizing, and oftentimes the symptoms can fall outside of those categories or look very different from person to person and include multiple different things.
All
So,
right.
just to kind of like encapsulate right? Like one of the things that we had talked about in episode 4 was how oppression and depression play off each other. I think in a nutshell, right, depression can often be, not always, but very often, a disorder of self-worth. And what we know about oppression is that it basically just communicates to us over and over again to naturally question and discount our self-worth. It says, like, oppression pretty much like says just to be ashamed of who you are and the things that you've done, to doubt or devalue your being. It tells you that your life does not matter, or that you're not good enough or worthy of care, like all of these messages. And we know that American society was built on these ideas through white supremacy, which basically just reinforces the narrative that white people have a greater value than that of black people. So you can see how for people of color and within our communities that there are certain things that we face in our environments that teach us to devalue basically devalue ourselves and to not care for ourselves as much. You can feel ashamed for some of the things that you feel, for what you desire, for even your preferences. You can feel like you shouldn't want things or shouldn't feel things. And we're so used to enduring so much, right? It becomes our norm. It's our status quo, right? Like when you're used to always having to endure, black folks have always had to endure a lot. And because it's our normal, what's normal doesn't really raise any red flags because it's always been that way. And so when you're always used to enduring, it's very easy to kind of like minimize and devalue what your experience is and how it's impacting you in a way that hurts. And so this is kind of like the slippery slope, I would say, where oppression and depression can be connected. And I also think that's how for us in our communities, it becomes really hard for us to reach out for help in light of these things too, right? Because we've always had to be quote unquote strong, quote unquote resilient, persevere, be twice as good to get half as far. Because we've always had to do those things, when you are struggling or when you are impacted or when you're feeling depressed enough where it does hit you at a conscious level, it can be hard to fully acknowledge that or deal with it in a way that doesn't bring about shame, right? Because you're supposed to just move on. And at bottom, like there is implicit in that there's a lack of value in what you're actually experiencing. And I think oppression both teaches that and then makes it hard for us to value ourselves enough to actually care about what we're enduring, care about what we're experiencing to the degree that allows us to acknowledge it and get help.
Yeah, I think it's also the concern when you mention getting help is like, who do I talk to for help? Or do I even think it's safe to talk to anyone for help? Do I think this is a safe space? Do I feel like you'll understand me? Do I feel like I won't be judged because of this? It's such a big choice to decide to talk to someone. The last thing you want is to talk to someone and then you feel like they don't get it, or you feel like you're judged by them, or you feel like it's just falling on deaf ears. Which is a big thing. I think it's also important that, we always advocate for mental health professionals and counselors and licensed clinical social workers, psychologists, psychiatrists. But it's also important to understand that you may not get the person that vibes with you the first time out when it comes to a clinician. Period. Like it will be great if the first person you met understood you and vibe with you perfectly. But there are so many different kinds of therapeutic orientations. There are so many different kinds that, and then in addition to the therapeutic orientations, like everyone has their own personality. The way that it vibes with the way that they, orient to this kind of therapy that they do. Right. So I always tell individuals, don't give up just because one person didn't work out perfectly with you. Right. I've had to change therapists multiple times just because it didn't work with me. And they were still good clinicians. It didn't work with my style. And I always joke about like how Justin's orientation is like psychodynamic therapy, which is more like delving into the unconscious. And that's not my primary orientation. But the clinician who worked best with me was a psychodynamic therapist, like a psychologist. Like, yes, I know you think that's very funny. But like,
only
so
because we joke about it and spar about it all the time.
And yet that's the person who works
And
for
yet,
me. She
listen,
works best for me. That was, not someone who had like the same orientation to me and came to the problems the same exact way. I needed someone who came at it differently, who provided more space for me to like open up on that sense. So it's important to understand, like, even me, or I think anyone, like, I see a clinician and I had to switch, like, no, this ain't gonna work for me, because but it's been real. Hasn't been real fun. I'm gonna have to find somebody else. So and just like search again.
And I think
like the person is out
also
there.
like to piggyback off what you're saying, like when you are meeting with your therapist, right? It's important to I think to just know, right, how valuable it is to be understood and heard, and to learn about yourself and what you're experiencing. And because what does that do, right? Like what that says, I mean, it really is, that is a self-valuing kind of process, right? To actually spend time talking through the things that have been complicated and challenging and painful in your life that affect you in multiple ways, right? Just doing that in itself is like saying, wow, I'm important enough to engage in this. And I think sometimes we have trouble even acknowledging that, right? Like this, like that, right? That I've been feeling irritable and unhappy with my life for the past year or so, right? Like that's important enough for me to actually do something about it. And that is antithetical to the messages that we receive in society and the ways in which we are oppressed, right? It actually is rebellious for a Black person to care about themselves, period. Because that's not, right? Like, there was something that I saw, it had to be on like social media like this earlier this week. There was someone who said, there's always like this really angry reaction to when a Black person says something that's affirming to the Black community, right? It could be something as simple as Black men are resilient, or Black women are resilient, or Black women are hardworking, and yeah, sure, these are generalizations, but there's always some like there's always some backlash to Black people affirming Black people and people having reactions to that, right? Like there's just a whole system of thinking about like how we should value Black folks, where we're usually like not valued as much. And so I think honestly, like that, typically not valued as much. I mean, let's be honest, right? Like
But why do you think that is? Why do you think
folks.
there's always that pushback? Like when it comes down to it, like why do you think there is always that pushback when if you state something and put specifically, I'm talking about Black people?
Man,
when it comes to positive traits.
How much time do we have?
You know what? Good point. Good point.
No, but that's such a good question. I don't know. I think deep down in the psyche of our society, like we all know the great injustice that are served to Black people and people of color all across this country. We all know, like, there's a history, and that history still lives on today. It still does. It's still like, to say, like, Michael Shea does this really cool stand-up this bit where he's just like, Black Lives Matter. Michael Shea is the guy, he does the weekend, what is it called? Weekend Report on SNL. I don't know. He does that like the news bit on SNL. And he says, like, Black Lives Matter is a controversial statement. Saying that I matter, just that I matter at all, is controversial, right? It's like, what's lower than matters? They exist, right? Like, that's the joke that he goes on. But it's like political. Like, to say that my life is important, it's a political atrocity, right?
There's always this question of there's always this, they act like we're saying, matters more, or
I know.
like and black pride is like against white people, and that's not the case. And I get like that stupid statement like all lives matter. Like, we get all lives matter, but all lives aren't being systematically stomped out. So we're focusing on the
Yes.
ones that are, and that's why we're focusing
Yeah.
on black people. If we're saying black girl magic and black boy joy, well, all children are joyful. Yes, they are, but you know what? All children don't get to be told every single day that they matter.
Yes.
Different races get told from day one that
All the
what you say
time.
matters. Your race matters. So you know what? I'm going to be focusing on the individuals who don't get this message every single
Right.
day. That's why it's an issue. That's why there's a need for that statement. And when
Right.
anytime someone says it, it's like there's a need for this statement, because we don't always get that. So you can't possibly understand why it's necessary to state that, because you understand from day one, from birth, you were told that you matter, but that's not how
Yes.
everyone else's life is. So that's why we
Yeah.
say it. This is why we say it, because
Yeah.
everyone doesn't get it.
Absolutely.
That's why every single time I see a black girl with her hair and it's all big and natural, I'm like, oh, you look gorgeous. You're probably like,
Yes.
or
Yeah.
you just
Yeah.
that was a very that like you could, because how many times do you think people get affirmed when it comes to that?
Because to be your natural self is actually rebellious. I had a good conversation with a colleague. We were doing this. We were just kind of like brainstorming about like office decor and what it says about like in terms of who it welcomes into the office space in a clinical setting. And she's a white woman who's really interested in kind of trying to understand this a little bit more. But one of the things that I ended up sharing with her is just that she was talking about like doing things that are neutral and so that we don't kind of like put anyone, we're not off-putting to anyone. And one of the things that I said is like, what's neutral and what's status quo and what's standard often leaves out so many people, right? Because who decides that? Who decides what the standard is, what's neutral, and what's normal?
The
right?
people in power. That's the
people in
problem.
power.
The people
Yeah.
in power are the ones who get to choose that. And how
So-
often are we in power?
Right.
It's not fair.
There's no such thing as passive activism. In order to actually invite people and be inclusive, you have to be active. Neutrality is not active. And so it's quite similarly, for us to actually care about ourselves, you have to be active. Like, it's not because, white folks are passively affirmed all the time. And they rightfully, I think, feel entitled to a sense of self-worth. Rightfully so. But we don't have that. And we've never had that. And so that's why even I think, one, just how like oppression leads to depression, but also what we have to do to kind of affirm ourselves and to be caring is actually rebellious. It actually takes a lot of guts to do that, and it can be challenging. But it's such an important thing for us to acknowledge that self-care for us is going to look different because of what society says about us over and over and over again.
Yes, and stay with the children, please. Like the children, adolescents, kids. Like, okay, I get it. I like working with adults too. I'm not going to say all of y'all are far gone. But I will say, if you want a fresh slate, I'm just saying, children are magical. Okay. Put all that energy in them. Okay. You get the
Yeah.
adults, Justin. Like, you get that. Okay. They're great. Okay. But kids.
It starts
okay?
young. It starts young.
It starts young. It is just an ounce of prevention is worth a pound of cure. Whatever. What did Frederick Douglass say? It's easier to
I know what
build
you're talking about. Yeah.
build strong children. It's easier to build strong children than repair broken men. I'm with the children. Okay, work,
Yes.
just please. You know what? Because also, okay, and then we can get back to the thing. I was doing a talk regarding anger and how it manifests in children as a result of trauma and how it messes with diagnoses and disparities when it comes to how our kids get diagnosed. And one of the questions that got asked of me is like, what's going on with the bullying thing, right? Like, why do you think bullying is so different in this day and age? So a lot of times I don't know how many times I've heard a patient say that they're getting bullied. It's awful. But a lot of times they're like, oh, well, I tell my kid not to bully. That's all well and good. How often do you have like legit conversations with your child about respecting others though? Not just don't just say don't bully others. Talk about why it's important not to bully. Talk about respecting yourself and respecting others. Talking about like how it's important. Even what respect is, like, what does respect mean to you? What does your value mean to you? How many times are we talking to children about values? Because if one of your values is integrity, you won't even bully because it doesn't align with who you are as a person. So it's one thing to tell a child not to bully, which is just like, we all know, you tell a child not to do something, they're not going to do it unless you ask them to, I don't know, pay attention to a rule. They'll not, that's the one rule they don't do. But if you talk to them more about values, you have to, children are really, really smart. They're very big critical thinkers, but just telling them not to bully isn't enough. You need to impart into them wisdom about like who they are as a person, who you want to see them as a person, who you are as a person, because you're understanding why children are bullying others and talking about people and being disrespectful. They're seeing it on TV, they're seeing it at home, they're seeing it in the car when they hear mom or dad talking to their friends, they're seeing it when their parents talk to each other disrespectfully, they're seeing it when you talk to them, or when so they talk to their siblings that way. It's more than just telling your child not to value not to bully people. It's talking about like who they are as a person and values. And the thing that makes it really difficult, especially with the population I work with, is a lot of parents don't have time. It's very, it doesn't take that much. It takes so much time. Not doesn't take that much time, but it's hard for parents to talk to their children about values and make sure you're imparting wisdom upon them and talking to them about integrity and respecting others when they're working 2 jobs and they're just trying to keep food on the table.
Yeah.
Or they work at one job and they just want to sleep. So I think that the gap in the bullying is like a lot of people aren't getting the amount of time that's necessary to parent, which can lead to depression, especially in kids, just to try to connect it back to the thing. But the bullying thing always irritates me because it's like, oh, I tell them not to bully. Okay, but why shouldn't they bully? Like, should they not bully just because, or should they not bully because it's a disrespectful act to talk about someone just for who they are? And it's also pretty superficial to not like someone because of their sneakers. What about their soul? Like, it's just,
It's also, as you said it, right? It's disrespectful to themselves and the other person to treat people that way.
But parents don't. Some people don't talk about that. Some people just say, just stop bullying. They don't say, don't be that kind of person. Don't impart those kind of negative energies on someone. Don't make someone feel bad. Don't think about like who you want to be in the future. They just say, don't bully. How simple is that?
Yeah.
I'm sorry. That just always bothers me. But
no, I'm sure as someone who works with children, right, you see that a lot, and I think self-concept starts really early.
Dude, it starts very early. We learned that from Mamie Clark and John Clark when they did the doll study.
Right.
Okay. We learned that when we see the kind of dolls that children want to pick and they don't pick the one that looks like them because that doll is ugly.
Yes.
And that doll looks just like them. What does that say about them? We learned that about colorism when we're talking about people who are getting older. We learned that about different hair types and the way that people perceive looking appropriately. We learn that every single day.
Yeah. Yeah, and part of why like I talk about the unconscious mind so much is because like those kids in the Kenneth and Mamie Clark study, right, who chose the white doll and said the white doll was more beautiful, was had more positive and glowing and redemptive qualities, like
it was clean. That was another one.
Was clean. Wow. Yeah, and they said all these like negative things about the black babies. Those black boys and black girls who were participated in that study and chose the white doll, right? Now, did someone go up to them and tell them, right, verbatim, this doll is good, this doll is bad, white is good, black is bad? Maybe not so clean cut. Probably not, right? It's in our world. It's the air that we breathe. It's our society. It's the everyday messages and micro messages that we receive all the time that we actually take in. We are porous. Our minds are porous. Those babies, even at that age, those kids, they understood that and knew that black was lesser than.
Yeah, and the whole point of that study was to help provide justification for Brown versus Board of Education because it was supposed to show that the negative and rampant and systemic effects that segregation have on children. Yeah, that was the biggest thing from the like that. It supported, that's psychology at its best. This the combination of like psych, research, application, social justice, political chanch. That's like what it should be the majority of the time because that's the biggest way to make change.
And I think part of the reason why we wanted to have this discussion is right because when it comes to like oppression and depression, like for a person of color, like our black folks, our mental health is political. It's political, right? Like we have to debate like whether even a politician actually cares at all about black people, right? We just came off of the Virginia's blackface government and all of the scandals, right? Like,
let's be honest, they're just the first ones to get caught. Come on.
Yeah, of course, of course.
But not even first ones to get caught, but they just happen to get caught.
But literally, not even just our mental health, like our entire well-being is political, right? There's so many more, like, right, as you say, there's probably so many more other like people in power who make decisions. Not to mention that Northam, the Virginia governor, who was caught, like, he is a medical doctor, and that picture is in his medical school yearbook, right? Like, this is someone who, and we've been on this show before talking about how doctors have certain assumptions about Black people, right? About how their skin is. There were those studies that we've cited in the past about doctors who believe that the skin of Black folks was tougher than that of white folks, or they didn't feel pain as much as white folks, you know? And so then you have a doctor.
They redid that study like 5 years ago too, by the way. They keep redoing. Yes, they keep redoing this study, and yet they're not getting it. We do not have invincible skin. No matter how much y'all keep trying to attack us with your words.
It's like, hey, like
your weapons.
We're
not
human.
A thing. We're still human,
we're actually,
dude.
Yeah. And so then you have like a doctor who's like kind of like wearing us like a character, you know? It's like some like mythical, it's like, you know, a costume, like people dress up as like Batman and you know, like people like dress up as like fictional characters, you know? So yeah, it's very, very dangerous, this idea of people not taking the humanity of Black folks seriously and also mocking us and then being in positions of power. And so yeah, oppression actually kills people. And it leads to depression, which can also lead to suicide, but also in terms of physical health and the biases of doctors and other people in power, it kills people.
Yeah, and I think one of the things that makes it even harder when it comes to depression is the difference in the way it can possibly manifest in men versus women. Right,
yes.
Like there's a difference in the presentation in depression in men versus women. A lot of the times, like for bottom line, like the onset of depressive disorder, it like peaks during adolescence. Like this is normally what I'm seeing, and like during early adulthood. But females are at a greater risk than males of having a depression diagnosis. They have like twice the lifetime rates of depression. But in my opinion, this is not
mine
because
mine too.
What?
I said mine too. My opinion.
Oh, our good. Correct.
I'm just co-signing.
But in our opinion, this isn't because like it's like, oh, you know, women are suffering so much more than women are suffering a lot.
Right.
But we're not going to get into that because that's a whole nother episode. But it's also because we have like this DSM, the Diagnostic Statistical Manual. This is the book, like the mental health Bible, right? And just like the Bible, it's has its flaws. Oh, my mom's gonna curse me out for that. But it's biased. Like, so that this is the book that we all use. This is the book we always reference when we're like, oh, these are the criteria for this disorder. These are the criteria for this disorder. This is what you need to be diagnosed with this. This is you know, yada, 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 or whatever. But it's biased. So, I mean, this book has been around. How long has this been around? A minute, right? Mm-hmm. We all use it when we're referencing mental health disorders. But when you look at, like, the requirements when it comes down to it to diagnose individuals with depression, it can be like, culturally biased. So there was... And not culturally racial and ethnicity. I'm thinking more culturally like it's biased against men when it comes to diagnosis of depression. So a lot of times you think culturally biased, you think like it's against a race, but I think it's culturally biased against men. Like, and it misses out on a lot of symptoms that can present in men when it comes to manifestation of depression. And this is why so many more women are more likely to be diagnosed with depression, not because we have depression more, but because it gets seen more, because we present it in a way that's more used to what's more like what people are used to seeing, easier for them to pick out.
Yeah. I think, right, like, It's not that women are just more susceptible to feeling depressed. Like, that's not right. And you're right. Like, women, and in particular women of color, deal with the challenges of being both minority and dealing with male privilege and patriarchy and misogyny, right? But it's not, and so that could be a part of it as well, that there's more that women have to endure in this society. But over the whole, biologically, it's not, there's no evidence to suggest that women are just more susceptible to feeling depressed, right? And so, to your point, Raquel, I think there are certain things that tend to get overlooked when it comes to male oppression, and I do think it has a lot to do with how men are raised and boxed into some of these aspects of like masculinity and identity.
There's a doctor, Dr. Michael Addis. So he's at Clark University. Not to be confused with Clark Atlanta. This one's in Massachusetts, guys. So I thought it was Clark Atlanta too.
Listen, when I saw it, I was like, oh, that's dope. It's Clark.
And I'm like, no, Justin, this isn't Massachusetts. So he's still amazing, but he does his research, the majority of his research, on the manifestation of depression in men and internalizing disorders such as depression or anxiety in men and how it's different, right? So his framework hypothesizes that men experience alternative depressive symptoms that aren't in the DSM-5, and because they're not in the DSM-5, that's why we keep missing these men with depression, right? So he stated that these kind of symptoms should be that should be included should be like self-destructive behavior, anger reactions, numbing of pain through substance use, and risky behavior too. Like, so if you were to quantify depression, if we took out like the irritability, depressed mood, fatigue, and stuff like that, and we added like angry reactions out of context, if we added risky behavior can just be like unprotected sex. I mean, but when is it ever really protected? Because your heart is always unsheathed, in my opinion. But that's just
that was poetic.
I know, it's just sensitive stuff. Okay, we're back now. Okay, and it can also be like increasing your use of substance use. Like, think about how many people would meet that requirement. So think about like a person who maybe has depressed mood, maybe has irritability, but they also had an increase in self-destructive behavior. They also had an increase in anger reactions, fatigue, maybe changing the way just they manifest themselves. That could be depression in men. And if we were to do it that way, then it wouldn't just be that he hypothesized that if we were to do it that way, then men would actually have more depression diagnosis than women. Like, it wouldn't be that like women have a greater lifeline likelihood to have depression. It would be that men did. And all you did was change the manifestation of the symptoms. And it's not like we're taking these out of like the air. These are things that are seen, right? These are the things that you're used to seeing when it comes to depression in men.
Right.
So we need to look at it culturally. Like, we're biased against men when it comes to depression, in a sense. Like, culturally, we're not really being open to the different manifestation of depression in men. And we're kind of selling them short in that sense. We're doing them a disservice.
Yeah. Well, we also do ourselves a disservice in terms of like how we how we understand men and emotions, you know. And again, I've said this before, but like, patriarchy doesn't just hurt women; it does also hurt men. Because in essence, there is this, and misogyny as well, there is this this idea that men are just not as human, or just don't feel as much, right? Or like, right? Like, a common thing is when men, especially in heterosexual relationships, a man calls a woman emotional. And really, if she has any emotion at all, right, all of a sudden she's emotional. Because as men, we're not used to being in touch with what we feel at all. Right, because toxic masculinity rather says, to feel is to be weak, right, or to be sad, or to be hurt, or to be down, or to be upset, or to feel worried, or any of those things is to be weak. And so very early on, we know how to like hide a lot of that, and to try to like repress and put aside what it is that we feel, so that we have some sense of self-worth. All the while not realizing that we are like cutting off literally parts of our humanity, and we're losing touch. We lose connection with ourselves, and also have trouble connecting with others. So when someone expresses an emotion, it's like, oh, you're being emotional or dramatic. It's like, well, actually, they're having a reaction to something real, but it's hard for us to get in touch with that because we're not in touch with our own reactions, or appreciate that because we don't appreciate our own reactions. And so, Raquel, is it also true that he actually, Dr. Adidas, is that how you say his name? Addis.
I was calling him Addis.
Addis probably better.
Now, I mean, that don't mean I'm right though.
I'm trying
like,
to name him after
you
the
really
shoe
try to
brand.
Negro it up, man. Like what? Like Adidas, Clark. What's like? God,
It was like
just
close.
So culturally insensitive, Justin.
It was almost Adidas.
There is no way that was Adidas. Ain't no way.
Anyway,
ADDIS.
brother man, is it true he did a study actually looking at if you included that framework, men had higher rates?
Yes, and that's where it's like it flipped it. What's that song?
Yeah.
Then I flipped it. What's the song the kids sing? Something. Then I flipped it.
Oh, that's a Kendrick song.
Okay, yeah, right. Okay,
yeah, that's a Kendrick song.
I'm hip.
No, I think it's a Future song and Kendrick's on it. King's dead.
Gross, and you lost me.
King's dead. Miss me with that bullshit.
It is, yeah, it is. Because I've been listening to that Black Panther soundtrack.
Yeah.
All right.
First of all, I don't ever remember the names of songs, so I just want to pat myself on the back for that.
You pat yourself on the back. You did a good job.
I
there.
appreciate that. But yeah, this is really interesting. Like there are if you incorporate all these other things that are quite common and indicators of depression in men, the ratio actually there were higher rates of depression in men.
Yes, and that's the biggest thing that I'm saying. Like it's like, in my opinion, women, we get more depression and and that's why I always, whenever I mention depression, I say depression diagnoses, because I wanted to be clear that just because there are plenty of people out there who are walking around without a depression diagnosis, but when we're doing research, we're going off of the data that we have, so we can look at the numbers and say that women are more likely to be diagnosed with depression at this certain aspect of developmental stage of their life. But that doesn't mean that they're more likely to have it, in my opinion, and I think it's because of stuff like this. There's also did we ever talk about display rules?
Yes,
right,
you've mentioned that before.
Just to do a review, display rules are just social group or culture's norms, informal norms that show how you're allowed to express yourself, right? And when it comes down to it, we talk about culturally why it's difficult for men to be diagnosed with depression, but this more so goes into culturally why it is more difficult for minorities or underserved populations to be diagnosed with depression, because our display rules are different, right? Because certain people may not think it's appropriate to manifest certain kind of emotions. So there was a study, which one was this? Oh, this one's 2000. This one, if I'm thinking of the right one, is 2012. And they did a study on these mothers, African American mothers, and they wanted to know, comparing them to white American mothers, how comfortable were the mothers with their children expressing emotions. And it was the typical ones, like anger, fear, sadness, or crying in public versus private settings. So, of course, what do you think the result of that study was?
I can only imagine.
So the issue with that study was that African Americans felt that it was less appropriate for their children to display negative emotions such as anger, fear, with stuff like that. And specifically when they looked more into it, because they looked at young men and young women, mothers of young men thought that there would be more negative social consequences of their child displaying these emotions. But it wasn't just that, you get delve more into it, but it's a concern that if they express anger, if they express fear, they'll be seen as weak, and that can mean their life. Or they can express anger and that can mean their life in a different sense, right? You can't really, how many times do you have to have a conversation with someone about, or not conversation, but I fear the day that I have to have a conversation with my child, listen, so no matter what you do, raise your hands, just be respectful, even when they're beating you. You can't do anything else. You can't show anger. You can't show, you just have to sit there, raise your hands up, put them above your head, state your name and stuff like that, and just try to make it home alive. Sacrifice that part of yourself, that, that pride and that integrity and even the fact that you're right in the situation just because we want you to make it home. And that comes out in every single sense. But the problem with minorities, if you're not comfortable expressing fear or hopelessness or sadness, how are you going to get the right diagnosis? This is where the problem comes in. The same way it's less likely to diagnose men accurately because we don't have the right tools and we're not looking at the right criteria. It's the same thing with underserved populations with Black children or Latinx children or Asian children. If you don't feel comfortable expressing your emotions and you're over here seeing this doctor and they're seeing you manifest as angry, why are they going to think you're depressed?
Yeah.
Why are they going to give you depression or anxiety instead of giving you some kind of impulse control or behavioral disorder?
Yeah.
That's the problem.
Yeah,
Like it's the
and
depression
that's
that comes
really
in the whole oppression thing that you were talking about.
yeah, absolutely, and that's really on the doctors who do that don't recognize one how it is for boys and men in terms of those display rules, right? The limitations that they have and what is perceived as okay for them to express or not express, and how some of those feelings often get internalized or externalized. And that's really that's on our community of healthcare professionals who still I think overlook that. But
Yeah.
for men, right? Like if there are certain things, right, based on that study that you're talking about, and especially for like Black boys, where the boundaries are even more rigid, and there is that pressure um, to be there is that pressure, right, to always be mindful of like what you're doing as a Black person and how people are perceiving you, because right, that there can be some sort of microaggression or some sort of reaction to your race, where because of that, like where else do your feelings go? Like where can you, right, if you're hurting, upset, sad, you're struggling, like where else, if you can't show that or express it, then what else do you do with it? And so some of the things that Doctor, I'm gonna mess up his name again. What's his name?
Adidas?
Doctor. What?
Dr.
You
Adidas?
really almost tricked me into saying it. I was about to call him
Dude,
Adidas.
you
I was really about to say Doctor Adidas again. That was about to happen.
I don't
Addis?
even know if I'm pronouncing it right, man. I just be
Is it
reading
Addis?
articles and hopefully I pronounce it right. I hope
We're
so.
gonna call
That's how
him-
I've been reading it in my head.
We're gonna call him Dr. Addis. Addis. I don't know why.
That's his name now.
I gave him a whole other vowel in that name.
You did.
But anyway,
and some consonants, but continue.
Oh gosh. But anyway, like part of the self-destructive behaviors and the anger reactions and the numbing of the pain, those are the things that he's talking about that aren't included enough when we talk about male depression. Like part of that, those behaviors are all really, particularly the self-destructive and the numbing of pain through substance abuse, is all about trying to take away the feeling. And another thing that, because there may not be an outlet for it, right? And that's where the confines of masculinity become really oppressive, when men have an inability of accepting their own humanity because we're taught so early that we can't feel or show those emotions. And so another way that this comes out is through escapist behavior, which is essentially either overindulging in leisure activities or in actually work-related activities. So this can be seen with people who are complete workaholics, never take a day off, never take vacation, and just throw themselves in their work so they don't have to sit still, right? You know, those people who sometimes they get so restless or unhappy or uncomfortable when they're still, you know? And that's because when we're still, those feelings come up. And I think for a lot of men, right? When those feelings come up, it's scary. You start to feel like there's something wrong with you, because on one level, it shouldn't be happening for you as a man. That's what our toxic masculinity tells us. And then on another level, we don't know what to do with it. So it's a problem that's operating without a solution. So it becomes really unnerving. So people who kind of throw themselves into leisure activities and work without having moments of stillness, sometimes that can be and we're talking about the extremes here, right? Like everyone, has to work or make a living or, do some things that they enjoy for themselves. But if you're doing it to such a degree in a way where you're kind of even avoiding those moments of stillness, there could be something to that. What that stillness would bring up in you, and kind of fill you up with, and that's just something to pay attention to. That happens a lot for men.
Oh, good. Okay.
I guess we should kind of start to wrap up here. Do you want to? Why don't we say just a couple of words of like how we, like just some ideas about how we might encourage us to be mindful of the signs of depression and what we might do if there's someone who's actually dealing with depression. Some things that we might do to manage that.
Like if we're like trying to help out a friend, or if we're trying to help out ourselves.
In general, anyone.
I
Tips.
try to stay mindful of. We all have like some kind of pattern, right? Like you have stuff that you like to do, things that you like to eat or stuff like that. I like to pay attention to stuff that I'm doing that I no longer enjoy. Like when there's been a decrease in enjoyment in what I'm doing. That's one thing. That's a big sign of anything going wrong. Like if you're no longer enjoying something, and not. It could be that you're continuing to doing. It can be multiple things. You're continuing to do that action, and you're no longer seeking enjoyment out. You're not getting enjoyment out of it, or you no longer seek out that action. So it could be like you really used to like crocheting or whatever. You're still crocheting 5 times a day, but you don't like it anymore, or you don't even pick up the crochet needles anymore. Anything like that. Sleep is something I always try to be mindful of, because a lot of times when I'm dealing with patients and we're doing like the first couple of appointments, I'm not really going to give you a million suggestions because I'm really trying to get all the information. But one of the things I'll always check in on and try to give a suggestion a little bit quicker than other suggestions are like sleep, better sleep, stuff like that. So if your sleep has significantly changed, like if you used to get 8 hours and you're getting 6, man, 8 hours, that's like undergrad levels. So like, let's be real, if you used to get 7 and now you're getting 5, I mean, that still might be a good day for you, but like that has a significant impact on the way that you're going to respond to different things. And eating. Yes. Like if you're eating more, you're eating less, but even if you're eating differently, like if you used to, try to put in some vegetables with your like cheesesteak every night, and now you're not even eating spinach with cheesesteak or something, like that changes how your body manifests stuff. Because a lot of times we go straight to, thinking about thoughts and feelings and behaviors and trying to manifest that. But sometimes it can be as simple as you need to sleep more, you need to eat better, and you need to go outside and walk. My really good friend, Dr. Maggie Farinas, she wrote out this article, and I'm actually gonna put it on my Facebook page. She wrote this article, and it was like, before you try therapy, I forget how long she wanted you to try working out. She's a licensed clinical psychologist. She's like, before you try therapy, try working out for a couple of weeks. And not to be a jerk, it was just like, try to see if this can help balance you out first, and then you can see if you can do the therapy thing. Like there are different things that can help you balance, and like it makes sense. Like if you read the article, I'm gonna put it on the on my Facebook page. I might put it like a screenshot of it on the Instagram. But that is something that you really need to check in with. And when you think about it, like as a clinician, what are some of the first things you key into when you're talking to your patients? It's like, what's your sleep like? What's your eating like? What are those habits? And then we can get into your thoughts, because you could be thinking you're eating and you're eating crap. You're like not eating real food. But I always look at activity level too. And also social support. Some people are loners. I get that. But you can still not like being around people all the time and still have enjoyment out of little aspects of social support. There's nothing really that great about being by yourself all the time. Like that's one of the things that we work on, like behavioral activation, is when you try to do the opposite of what you would normally do when you're sad. So if when you're depressed, you go home, you stay in bed, it makes you sadder because you're not around people, and then you're crying and then you get more sad. Then as soon as you get home and you get sad, instead of laying in bed, put your sneaks on and walk out the door, because you got to change something to get something different. But I would say those are the biggest things I look at, the quickest things I look at before I'm like delving into the depths of your soul and your inner psyche. Eating, sleeping, activity level. That's my trifecta first couple of things. And I think that's in eating, activity level, and then interest level. So eating, sleeping, activity level, and then interest level would be the big 4 things that I look into.
Yeah, good. I guess the only thing I'll add to that is just that what you were talking about, behavioral activation, as it's called, which is, basically, as you said, right, just getting up and doing some things that you might look forward to or be interested in or feel a level of mastery and competence over. So it could be like accomplishing something or just doing something enjoyable. Those things are particularly helpful. And it's hard because one of the worst things that you can do when you are depressed is absolutely nothing. And yet you often may want to just do absolutely nothing. And so it does take effort, but also with that effort, patience with yourself, because it's being depressed can feel all consuming. Any level of depression, any type of depression that we've talked about today, it can really feel all consuming. And so it's not a linear path to recovery. It's not just going to go clearly from being down in the dumps and then straightforward upwards into health and feeling good about yourself. There are going to be some bumps in the road. There'll be some faltering. There'll be some obstacles. There'll be days when maybe you don't do some of the things that might work for you. But over time, right, it can get better, and it can over time, the things that you do can accumulate. And so try to be consistent. Consistency helps. The effort helps, but also be patient and forgiving of yourself. I also think it takes a lot of courage. I think depression really is way more often than not a disorder of self-worth. And so it takes a lot of courage to actually love yourself with truth and a level of kindness that is genuine. That isn't narcissistic, but isn't self-hating, but there's healthy pride, there's healthy sense of enjoyment in oneself. It takes a lot of courage to really, truly love yourself, and I think that's especially true for people who have endured depression, right? For Black folks, I think it takes a lot of courage for us. So I would embrace that. Right, and try to use that courage to do the things that you need to do in order to treat yourself with the kind of kindness and love that you deserve. And so along those lines, like, it's where you encounter the rough parts of yourself, maybe the parts that you aren't that fond of, or the parts that you have some regret over developing, bad habits that you know that are still there in your life. Try to meet those rough parts of yourself with kindness, with calmness. And when you do that, like, it becomes so much harder for, like, agitating thoughts to consume you, right? When you actually meet the parts of yourself that you don't like, the rough parts of yourself, with a level of empathy, with a level of calmness, it goes a long way. And so I guess that's it. That's all I got for today.
I feel like I just got like a bit of a perspective of your therapy sessions. Like, and then you have like such a calming. Look at you in your therapeutic tone, man.
Every now and then it comes out. Thanks, Raquel.
It's crazy.
Think.
It's crazy. It's like, and then I feel myself being lulled into a sense of calm and just listening to the melody of your voice. You have a therapeutic voice. When we started this, what was the thing I kept telling you? We started this, all my mom and her friends, that guy got a nice voice. I like his voice. I'm like, mother. Like, what's a Justin? And she over here calling you Justin and everything. I'm like, you don't even know him. It's Dr. Hopkins to you, ma'am. I heard that. I tell you, I heard that a million times. Like, he has such a nice voice. You are right too, but his voice is amazing.
It's the patience. It comes out in my tone every now and then.
It's just your voice. You just have a nice voice.
Thank you, Raquel.
Nice.
I appreciate the affirmation.
Oh, also, you know what I was thinking? Because we were talking about, like, I was like, I want to focus a lot on men with the depression thing. Mm-hmm. Jeremy and Kier have that group.
Those are our guys at Let's Talk Bro.
Yeah, at Let's Talk Bro. They have this group, something about men. I kind of tuned it out after that. It's like a social support group. It's a social support group. And I think it's starting out on Facebook. We can post something like on our Instagram story, something like that. But the whole point is, like, to get you guys together to talk and, like, have fun, because I think it's really hard for guys to meet guys. Like, I don't know how you guys meet friends. I will legit hang out with a chick for, like, months upon years, and the first conversation we had was like, girl, how did you get your curl pattern? Or, I like your face. I legit have just told women that I like their face. It's just that simple. It's really just that simple.
It's called the Let's Talk Bruh podcast group. And it's
the Let's Talk Bruh podcast group. Awesome
Yeah.
idea. They're going to be like socializing and doing stuff like that. We have an upcoming event with them, which is going to be so freaking cool. You guys are going to love it. It's going to be amazing.
Yeah. So more on that.
Yeah, but look into that because the social support aspect is a big thing. It is like I get so much energy from hanging out with my girl tribe. They're all goddesses. I love them. I think men should be able to get that too. Like if you're moving to a different area, or if you want to just hang out with people, if you want to just watch a game and have somebody in proximity to you, like that can really help you just even out a little bit.
Yeah, absolutely. And you know, I think to that end, maybe this is something for us to continue to talk about, but just how I've heard from so many different like patients, friends, colleagues, men in particular, about this waning feeling of isolation, or either that the feeling of isolation, or just feeling like there isn't as much depth in their conversations with other men. And so it's another thing that's in our culture, in our zeitgeist, where people are becoming more aware of it. There are men's groups starting out all over the nation, you know, and I think we ought to also be careful about like some of those groups. Within homogeny, there can at times like be people just kind of getting caught around ideas that may be oppressive to other groups. But I think the idea for a lot of these groups is for men to actually genuinely connect and genuinely establish relationships that make them feel less isolated. But I think the isolation piece, is a big part of masculinity and also the depression. So on that note, guys, we are going to wrap up. It's been great. It's been fun. Please check us out on our IG at The Black Unconscious, on Twitter at BLK Unconscious, Facebook, The Black Unconscious. We do have our website, theblackunconscious.com. You can always shoot us your questions at theblackunconscious@gmail.com. We hope to hear from you all. As I shared a couple episodes ago, I am in private practice. And I have my new office in DuPont Circle. You can find me at...
I'm like your hype man right now. Keep going.
At drjshopkins.com. That's drjshopkins.com. I am taking referrals. And also we're both very much interested in doing more speaking engagements. So if you have an interest in having us, we're happy to kind of take the charge of talking about mental health, and in particular Black mental health. Yeah,
I just did a talk with a department, a program in Philly, and like the topic of the talk, it was like for 2 hours for case managers, social workers, and things like that, and just things that they can do to help try to with foster parents or any things like that regarding keeping an eye open for maybe some symptoms that are manifesting a lot, like anger and things like that, and how that can come into possible referrals to mental health. And that was really, really fun. We have like a lot of topics, like we know things here, like we've been studying forever. So like couples therapy, individual therapy, children, adolescents. Couples therapy is more Justin Spiel. So if you want someone to come in, if you want to hear this melodious voice in person, guys, he can come and visit, guys. Like this is a real thing. He knows stuff. And anything, like even if you want to just talk more so about stigma, or I think it would be cool for us to maybe try to do some kind of mixed groups when it comes to getting people together, because we're like fun.
We're gonna more to come from us. We've got some ideas in the crock pot.
But thanks, guys.
For now, peace out till next time.
Until next time, listen to us anywhere you can find a podcast. Leave a review, subscribe. Throw us a couple of dollars. Just kidding. There's nowhere to send us money.
Email? Is that can you do that? Gift cards? I don't know.
No. Have a good day, guys.
Bye.
Bye.